Okay, so you've probably heard about the shingles vaccine, and maybe you're thinking, is that really something I need to worry about? Especially if, you're not in that older age group or feel pretty healthy.
Yeah, it's a good question. But shingles, well, it's definitely something worth understanding, regardless of your age. It's caused by that varicella zoster virus.
Ah, the same one that causes chickenpox, right?
Exactly the same one. After you have chickenpox, the virus doesn't actually leave. It just sort of lies dormant. Shingles is when it wakes back up.
And it's not just like a simple rash, is it? I've heard it can be seriously painful.
Oh, absolutely. We're talking about a rash, usually on one side of the body, often with blisters. And yes, the pain can be quite intense.
And that pain can sometimes stick around even after the rash is gone. That sounds really unpleasant.
That's postherpetic neuralgia, or PHN. It's this nerve pain that can linger for months, sometimes even years. It can be really debilitating for some people. And, in rare cases, if it affects the nerves near the eye, it can actually cause vision problems, even blindness. It's serious stuff.
So hang on. Even if I had chickenpox way back when, or I got the chickenpox vaccine, that virus could still be hiding in there.
That's precisely it. Think of it like the virus is sleeping in your nerve tissue. Then, if your immune system gets a bit run down, maybe from age, stress, illness, certain medications, it gives the virus a chance to reactivate.
Okay, that's kind of unsettling, actually. And it's not that rare, is it? I saw a statistic that was pretty eye-opening.
Yeah, it's estimated that about 1 in 3 people will get shingles at some point in their life.
1 in 3? That's way more common than I realized.
It really is. So that's why we wanted to take a closer look today, understand the risks, who's susceptible, and what the deal is with the vaccine.
And it's definitely not just an older person's disease, right? I mean, younger people can get it too.
That's a really important point. Yes, the risk increases as you get older, but younger adults aren't off the hook. Things like not getting enough sleep, being under a lot of stress, anything that compromises your immune system can make you more vulnerable.
Like what sort of things?
Well, certain medical conditions, treatments like chemotherapy, but also, interestingly, even things like pregnancy or the postpartum period can temporarily weaken immunity.
Right. Okay, so what does it actually look like? If someone thinks they might have it, what are the signs?
Often it starts before the rash even appears. You might feel pain or tingling, maybe itching or numbness in a specific area, usually just on one side of your body or face.
Like a warning sign.
Kind of, yeah. Then, a few days later, the rash shows up. Typically, it's a band or a strip of red, swollen skin, and then these fluid-filled blisters develop. People often describe the pain as burning, stabbing, or aching.
And those blisters, they're contagious.
The fluid inside the blisters is, yes, it contains the active varicella zoster virus. So if someone who's never had chickenpox or hasn't been vaccinated against it touches that fluid,
they could get chickenpox. Not shingles, but chickenpox.
Correct, to get chickenpox. That's why it's really crucial if you have shingles to keep the rash covered, wash your hands often, maybe even wear a mask if you're around vulnerable people like newborns or those with weak immune systems.
Got it. Now, I've also heard some chatter recently linking shingles to COVID-19. Is there anything to that?
There is some emerging data suggesting a possible link. Some studies indicate maybe a slightly increased risk of developing shingles after having a COVID-19 infection, or potentially even after the vaccination for some individuals, though more research is needed.
Interesting. And what if you've already had shingles once?
Unfortunately, you can get it again. Your risk of a recurrence is actually about 2 to 3 times higher if you've had it before.
Okay, so it's common, potentially very painful, can have lasting effects, and isn't just for the elderly. What can we actually do about it? Let's talk about the vaccine.
Right. The good news. There's a very effective vaccine available now called Shingles. It's what's known as a recombinant vaccine, which means it's not a live virus.
So it can't give you shingles.
Exactly. It uses just a specific protein from the virus to teach your immune system how to fight it off. And it's approved for adults aged 18 and older.
18 and up. Okay. And how effective is it?
It's actually highly effective. Studies show it provides somewhere between 91% and 97% protection against shingles. And that protection seems to last quite a while, potentially up to 10 years or more.
Wow, 91 to 97% that's really impressive protection. How does it work? Is it one shot?
It's a 2-dose series. You get the first shot, and then the second one is given 2 to 6 months later. Completing both doses is important for that long-lasting immunity.
And who should get it? Pretty much any adult.
It's recommended for most adults 50 and older, and also for those 18 and older who might have weakened immune systems. Importantly, even if you think you had chickenpox as a kid, or even if you've already had shingles, The vaccine is still recommended because natural immunity can fade.
Are there any reasons someone shouldn't get it?
Yeah, a few standard contraindications.
Yeah.
It's not currently recommended for women who are pregnant or breastfeeding, and they advise using contraception for 4 weeks after each dose, just as a precaution. But for most adults, it's considered safe and beneficial.
Okay, so let's quickly recap. Shingles. Reactivation of the chickenpox virus causes a painful rash. Risk isn't limited to older people's stress. Immunity dips matter. The blister fluid is contagious for chickenpox, and there's a highly effective 2-dose recombinant vaccine, Shingrix, available for adults.
That sums it up pretty well. Considering how common it is, the potential for significant pain and those lasting complications like PHN, plus the fact that risk factors like stress are so widespread, it really makes you think, doesn't it?
It does. It leads to that final question for you listening. Given all this, what proactive steps might actually be worth considering for your own health right now? Something to definitely mull over.